Hi, it's Ashley Latta here with today's Lunch and Learn. Just got off a coaching call today with a dentist, and we were helping him, coaching him on a one-to-one basis. Now this dentist lives in Australia, and so they've been back to work for a while now. And one of the areas he wanted some help with was objections from his patients, particularly around pain and the worrying about the procedure. So let's talk about this in a little bit more detail and hopefully give you a few tips that can help you if you ever get this pain objection from your patient. So let's think about it. You're in a consultation, everything's going really well, but the patient comes back and gives you, well, I'm really like to go ahead with the treatment, but what's stopping me is I'm concerned about the pain. Well, there's just a few things you need to do. The first thing you need to do is what I call show empathy. You must show empathy to your patient. They're probably a little bit nervous about bringing it up, or maybe they're a bit scared. So you've got to show this empathy. And the best way of showing empathy is just saying something like, Mr. Jones or Mrs. Smith, whatever your name is, it's perfectly normal to feel that way. Many patients like you feel exactly the same. Okay, now that's what we call an empathy statement. Now, why are empathy statements important? Well, the first thing is, it shows that you care, and it also shows that you've listened to. But the other thing about it is this. The patient was probably a little bit scared or worried about bringing this up. And what you've done is showed empathy. Especially if you say something like, don't worry, other patients like you have felt exactly the same way. So an empathy statement is really important. Now, the second thing you need to do is ask a question to find out what is it in particular about the pain that they have an issue with. And that's really important. Don't make the assumption you know exactly what it is. So with pain, it may be a couple of things. Maybe they've had a bad experience in the past, or maybe they've heard something from a friend or a relative that's had similar treatment, and maybe it was painful for them. So what you need to do is find out exactly what it was about the pain and what it is that worries them. Now, in this particular instance, this guy had a very high level job and was worried about pain in his workplace, and was worried about possibility of interrupting, because he was a speaker, he had to do a lot of speaking, he was in sales. So when you think about it, what he's really worried about is how will it affect his work? Probably not too much about the pain, but the impact it will have on work. And that question is really key. So once you show the empathy, ask the question, and you go back and say, Mrs. Jones, we may be able to help you. Do you mind telling me what is it in particular that you're worried about? What concerns you about the treatment the most, because we can help you. And once you can do that, you can find out exactly what their objection actually is, and then hopefully overcome it. In this instance, it was quite easy to overcome, because what the dentist could say that, well over 95% of people go back to work and don't have any problems at all. And if there's any problems, that the dentist would offer some paracetamol or some tablets they could take that would hopefully soothe that pain. But on most occasions, you should be okay to go straight back to work. And that's all that the patient was worried about. So very quickly, just a quick summary here. If you ever get patients who come back to you with pain objections, first thing you must do is show empathy. It's perfectly normal to feel that way. Many patients have felt the same way. But the second thing is find out exactly what it is that they're worried about, so you can help them overcome their concerns, so that you've got a win-win. Patient gets the treatment, and of course you get a chance to deliver it. Hope that's been useful. Good luck.